Moving ahead now, across the African continent, the International Committee of the Red Cross is sharing accurate information on COVID-19 and how people can protect themselves from the disease. The group is also directing millions of euros in relief funds to the fight against the virus. Now, in Nigeria, the Red Cross has expressed readiness to scale up its humanitarian support and response as the number of coronavirus infections continue to rise. He has also placed about 1 million volunteers on alert as support during this pandemic. Joining me now via Skype for more on this is the branch chairman, Nigeria Red Cross Society, Lagos, Adebola Kolawole. Adebola, it's good to have you join me this morning. Now, the Red Cross is doing so much. However, the emphasis on the numbers of people who are infected and those who are discharged and those who have died have taken away the understanding or the extent to which effort is being put by people who are not necessarily making the news on a daily basis. Talk to us. How challenging is it for the Red Cross in holding up this time in all of the effort that is put into helping people in volunteer cases?
Yes, you can see that, like I've mentioned, that the rate of the infection is going up every day, all because people are not abiding by the rules of the game. The government have asked people to stay at home, and people are not staying at home. But on the part of Red Cross, we have been going out for sensitization for quite some time. February 27, we had a training for our volunteers, and the volunteers went down to local governments, all the communities in Lagos State to step down the training by telling them the rules and that they should follow, that this pandemic is real. People should stay at home, they should wash their hands. The sensitization went a long way. And as I speak, we have not stopped. We are still on it. And because the pandemic is affecting people's health, and also the hunger aspect of it is a concern for the Red Cross, both in Lagos and at national. The Red Cross in Lagos State has put on a lot of activities like the intervention program for the masses, especially those that are poor, that could not even afford meals before the lockdown or before COVID-19. The widows in our society, the people living with disabilities, people above 70 years of age, we are planning them packs of food for each family for 1 week. And we are planning to start at Makoko because Makoko is our base, and we believe that charity begins at home. Hence, we are starting, because Makoko is also a slum, we are starting from Makoko by distributing 250 food packs that can last a family of 6 for 1 week. And by the grace of God, it's going to be a continuous exercise. We are going through some local governments in Lagos State, especially the low areas like the slums and where we have a highly density population.
All right. Now, Adebola, when it comes to times like this, we see how challenging it can be reaching people, communicating to people. But talk to us basically, what are the greatest challenges that the Red Cross is facing in its work?
One of the greatest challenges we are facing, let me first appreciate all our donors and sponsors that have been helping us. But I want to say that one of the greatest challenges is finance, because we run the society, as you are aware that it is an arm of government that was set up by Act in 1960. That was the act that set up Red Cross. So we are subsidiary to government, and we have always been partnering with government, especially in Lagos State. The government of Lagos State has been helpful to us. They've been helping in their own little way by supporting us to achieve some of our 7 fundamental principles in Red Cross. But as I speak to you, this intervention I'm talking about is one of the challenges. We need people to come and support us, and when we talk about disaster, you know, we are very known for disaster management too. We need people to support us by getting us some of this PPE, personal protective equipment, so that we can be well equipped. And as I speak, we need people to come and donate to Red Cross, even in this cause of our intervention. The little we are able to generate with the committee is headed by the former National President, Sir Emmanuel Ijewere, with other notable members of the public, that we are setting up this intervention for the COVID-19 intervention food relief. I want people to come out and help us in this area. They should come and donate generously to Red Cross. We are known for integrity. And whatever money that comes in at this time will be judiciously accounted for. And we have a motherless and abandoned babies home there. We need people to come and support this home. And at this COVID-19 pandemic, it is very essential, it is very important, it is a great thing for people to come out. The people that can, the government, the non-organization sector, the public sector, and the big companies in Nigeria. We need the philanthropy to come up help us. We have set aside an account, an account that is solely meant for this purpose. And we will be glad if people can donate into this account.
All right, we have to leave you here now. Adebola Kolawole of the Red Cross Society in Lagos. Thank you so much for your time on the program.